So, people keep asking me, what am I going to do when I get out of residency? Almost like I'm in prison. But I can tell you exactly what I'm not going to do, and that's work under the health insurance model. I refuse to let insurance companies dictate the care that I deliver to my patients. I want to have transparent cash pay prices instead of the inflated numbers that most practices charge, since they only get reimbursed for a small percentage from insurance, so they jack up the sticker price to make the math work. That's not a fair system, that's a workaround. I also don't want to defer to companies that have literally zero interest in patient outcomes and put my patients through the ringer of appointment after appointment just to get one thing done. Prior auths, denials, the good old try this cheaper drug first and let us know in 3 months if it doesn't work. So much for the art of medicine. Here's something that really doesn't sit right with me. A huge percentage of practices and hospitals in this country are owned by people who never went to medical school. People who don't understand patient care at a foundational level, telling physicians who do how to practice. The person closest to the patient should be the one calling the shots, not somebody that's optimizing for a quarterly margin. I watch this stuff play out every single day because I'm currently in the big academic system. I see the attendings that I respect most spending more time fighting the system than actually being able to practice what they're best at. I also see patients who needed something done 3 appointments ago finally getting it after jumping through numerous hoops. I see what that does to good doctors over time, and it ain't great. More power to the doctors making that model work because we need them, but I've watched too many great physicians burn out chasing RVUs, fighting insurance for basic care, and spending 2 hours on a computer for every 1 hour with a patient. That's not the doctor I want to be. I'd rather be completely transparent with my pricing, give you my full attention, and actually solve the problem. What do you think?